Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
Welcome to St. Louis on the Air. I'm Sarah Fensky. Even before the COVID-19 outbreak, many local senior citizens were vulnerable to isolation, and with that comes some poor health effects. The problem was especially acute for seniors living alone. The Community Health and Partnership Agency, which is also known as CHIPS, wanted to do something about that. It teamed up with the St. Louis Housing Authority, and with training from workers at St. Louis University, they set up a group called Circle of Friends. Beginning last fall, they helped seniors get together in small groups and begin to connect. And while those groups have been affected by the coronavirus, the facilitators are seeking new ways to tackle loneliness during this time. So joining me to talk about this important work is Marla Berg-Wager. She's a professor in the School of Social Work at St. Louis University, and she's also executive director of their Geriatric Education Center. Marla, welcome to the show.
Thank you. I'm happy to be able to be on the show today.
And we're also joined by Regina Stewart. She's a facilitator with Circle of Friends. Regina, welcome.
Thank you.
So Marla, tell me, I understand this does predate the coronavirus by many, many months. What was the genesis for forming these groups?
So the Gateway Geriatric Education Center at St. Louis University has a federal grant to enhance geriatric workforce. And one of our initiatives for this year, or for this cycle of funding, is that we have developed this evidence-based intervention called Circle of Friends, which was developed in Finland some years ago. And it's a group intervention really focused on being able to address loneliness and social isolation among older adults. And we have some partners in the community, and Regina is facilitator of one of the groups with a partnership between Community Health and Partnership and St. Louis Public Housing Authority, to be able to do these groups. And we developed training, and we've all been working together over the last, since the early fall, to be able to bring together older adults who otherwise are not having a lot of contact with others or may be lonely.
So, Regina, you were a facilitator for one of the first groups, and that was beginning last September. I understand the participants were your neighbors. Did you know many of them before this?
Some I did, some I didn't. I just want to say, Sarah, I thank you on behalf of the other four facilitators who have worked just as hard: Roberta Collier, Edith Guthrie, Celeste Jameson, and Dolores Quinn. We knew some of our neighbors, some of them we didn't. And in one case, one of the facilitators, I believe that all the people that she has in her group, which is the largest group, Edith's group, they were kind of fairly new to her.
Okay. So describe that first meeting for you. What was this like to get everybody together there in person and try to open up these channels of conversation?
The recruitment was so much fun because people didn't want to initially be part of anything that talked about that they were lonely, that they had depression, that they were isolated socially. But as we began to talk to them, encourage them to become part of something different and something new, they got in there. And I remember at our first meeting how people went around the table and they kind of talked about how they weren't lonely, how they didn't feel isolated. But by the second and third session, they said, I didn't identify what that was, but I guess I was.
They had kind of an awakening. They began to understand some things about themselves.
Mm-hmm. Mm-hmm.
Marla, is that typical that people might think, I don't need a group like this, until suddenly when they have it, they realize they were thirsting for it?
Oh, absolutely. I think that, that most of us, if you ask us, are we lonely? Are we socially isolated? We say, no, because we don't want to appear as though, we've done something wrong or we're not doing what we're supposed to be doing. So, no, I think it's really to the credit of those 5 amazing facilitators that they were able to draw people out and to get them engaged and to get them connected to other people.
So, Regina, once you had that first meeting and you got to the second meeting, people are starting to let down their guard a bit. What are the things that you hear being discussed at these meetings?
Different ways to connect with people. They had everyone had kind of personal things going on with them. So we talked about family, extended family. We talked about services that they were having or they didn't have. We talked about their eating habits, learning something new. So everybody began to connect based on what their personal needs were.
And as a facilitator, were you driving the conversation in specific ways or just letting it kind of go where it wanted to go?
Well, we had a good solid agenda every week. We always start our meetings in prayer and we end them in prayer. But in between, we're given our participants are given the opportunity to talk about something that happened different in their life the week before. We just kind of recap where we've been. And then we began to integrate different things, and we began to plan some things together as well.
And did you see friendships beginning to form amongst individual pairings of people?
Initially I saw people letting their guards down just to accept other people, and then I began to see a couple of friendships here and there where they kind of lean on each other for different things.
That's just terrific to hear. I actually want to go to the phone lines. We have one of your fellow facilitators who's calling in, and I think it would be great to hear from them as well. Let's talk to Irene, who's calling from St. Louis. Irene, hi, you're on St. Louis on the Air.
Hello, how are you?
I understand you're also a facilitator for these Circle of Friends meetings. How have you felt the impact of this group getting together?
I enjoy it. Matter of fact, I miss participating now. I really enjoy it. It's great.
And what have been some of the meaningful conversations that group has been able to have?
We talk about a little of everything. Like you all were saying about depression, we participate in different things. It's just different things that we do and talk about.
Mm-hmm. And do you see changes coming over the seniors that are being part of these conversations?
Yes, I do. Because you get a chance to talk about different things, and you're not isolated. And as time go on, people kind of started opening up a little bit more.
Mm-hmm. I can see that. Well, Irene, thank you for that call. I appreciate hearing your perspective. Regina, I understand this was supposed to end. There was some sort of endpoint, I believe, in December, but that didn't happen. What happened instead?
Well, about halfway through, a little bit past halfway through, all five of us facilitators realized that the groups that were formed didn't want to leave after 12 weeks. And we were coming up on 12 weeks quickly, and we realized that one of the things that we said is that you don't make new friends and then kick them to the curb because you got new friends.
That's a great point.
And so we made the decision that anyone who wanted to stay on for the second group could, and several of them did. Several of them have continued on because they bonded with people, which made their health better, how they felt, their self-esteem. I've watched self-esteem go off the hook, and people their health is better. They're not as sick. And in our research, we learned that loneliness and isolating socially, it messes with your mind and with your health. And so we began to look at different ways to combat that and alleviate that. And let me say that as facilitators, we found ourselves healing in different ways based on what we were researching, what we were bringing to the group, what we were getting from the group. we found ourselves in a different place because we're all seniors as well.
And so you're not just facilitating, you're also able to benefit from this.
Yeah.
Marla, Regina was talking about just the physical impact of loneliness. What do we know about how groups like this can help alleviate some of those problems?
Well, we know that being lonely and socially isolated has significant physical health and mental health impacts, as Regina mentioned. But I think what a group like this does, what the research on this particular kind of intervention shows, is that people report, even after 2 years after participating in a group, they report that they are no longer lonely because they've kind of gotten over that hump and they're more confident and capable of making connections to people. We know that their health improves. We know that they go to the doctor less often. We know they get hospitalized less frequently. And they're more likely to be able to stay in their own homes longer, if there's some kind of chronic illness. So there's some significant positives that come out of being in a group like this.
Marla, you'd also mentioned that this was something that was developed in Finland, and we think of that as such a different country than us, that they're just set up with a different sort of social net. And were there any big adjustments you had to make this work in the U.S.?
Well, we consulted frequently and regularly with the founders of this intervention, and they were extremely helpful in helping us think through how to do it. We have made some adaptations, and as the groups are beginning to emerge around the St. Louis area, as part of the training, I say to everyone, you know your populations that you're going to be targeting for, participating in a group like this, and make the appropriate adaptations. And I think Regina's provided a great example of what she and the other 4 facilitators have done to meet the needs of their particular participants. And I think we're fortunate that the founders of this intervention, who've done all the research, have been so gracious to be able to tell us that adapt it to the needs of the people.
That is so great to hear. And we're talking to Marla Berg-Wager. She's a professor in the School of Social Work at St. Louis University, also executive director of the Geriatric Education Center. We're also talking to Regina Stewart, who's a facilitator with Circle of Friends, this innovative program we're talking about that helps relieve isolation among seniors. Now, that's all the good news. Unfortunately, the bad news is what is the bad news for so many things these days. And I understand these groups can no longer meet in person because of the COVID-19 virus. Is that correct?
That's correct.
So, Regina, how are you adapting to this? It sounds like people really made such close bonds. What was it like to have to say, yeah, we can't meet in person right now?
It was not easy because people were used to our group. Our group meets on Wednesdays. Mm-hmm. And our oldest participant is 94 years old.
Oh, my.
And so a simple call, what I do is I call everybody. I call them. I make sure that everything's okay. If they need some kind of services, I get in touch with whomever can help them to see if we can do something to facilitate maybe getting a meal, getting them some food in the apartments. Mm-hmm. Just talking to them. And sometimes that's all it takes. We have one participant, for instance, who is recovering from alcoholism. Mm-hmm. And he fell off the wagon last week, and someone called me and told me, we got to get him up into his apartment. So I called him and had one-on-one. So we have a session every day. Mm. And we talk about, what's going on with him, what have you, kind of like a 2-person AA group. And that's what we do. And I keep them assured that as soon as everything gets better, we're going to be back together physically.
Those are some really serious issues to be dealing with. And I know so many of us just feel overwhelmed without even having that level of pressure on us. Has this been a hard time for you, too, trying to make these phone checks with everybody and, dealing with, say, something that serious?
It is. But, we have other things that we lean on. For instance, one of our participants our male participants, he has a green thumb. And so he got us to all planting these beautiful plants. And so people talk about their plants and, where they're at now with their plants. And they talk about future plans. We never got around to crocheting. One of our groups is doing a lovely, wonderful quilt. And they're real excited because they're going to enter that quilt into the St. Louis Senior Olympics, which right now is on hold. Mm-hmm. So, there's a lot of things that are intertwined, and I think that I know that all of the facilitators have jumped through some different kind of hoops and did some different kind of things and became very innovative to keep those groups together to make people feel comfortable and that they're not panicking as well. Mm-hmm. And there's, once again, that's being helpful to me, and I know to Roberta and Edith and Celestine and Dolores. I know it is because we get an opportunity to talk beyond our families, who, of course, are worried about us, but, we get a chance to talk to some people and come up with some new stuff.
Yeah, I love the idea of you guys all checking in on, giving updates on how your plants are doing, that kind of common shared activity, even if you're all in different apartments.
Yeah, whether or not they're dying.
I hope not, but yes, I guess that happens to plants as well. Marla, for the rest of us who aren't involved with something like this Circle of Friends community, what can we do to support older adults who may be dealing with these kind of stressors and loneliness?
Well, I think staying connected, and that's exactly what the facilitators of Circle of Friends are doing. Just stay connected. There's a lot of different ways to stay connected. There's a wealth of information out there about, the basics of video conferencing and FaceTiming and lots of apps that will help people stay connected. But you know what? There's always the phone. Everyone has a phone, and so just trying to stay connected on a regular basis, just like the facilitators are doing. I think encouraging people to maintain their regular routines because that provides comfort and familiarity for us. Trying to stay healthy, trying to get some exercise, trying to maintain regular sleep. But I think a really critical piece is to stay in touch, and this is something that us connecting with older adults can do, making sure that their feelings and their needs are being addressed. Regina talked about asking people what they need, and I think, being able to say to older adults, you got plenty of food in the refrigerator, is there something we can bring you, that kind of thing. And staying calm and being creative. There's lots of ways to be connected that maybe just require us to stretch our thinking a little bit.
I know that there's some efforts, I guess the Metropolitan Congregations United, they're going to work with St. Louis County and other statewide community organizations to create a phone banking effort to reach seniors. And for people who may find themselves in a position of making phone calls to a stranger, what advice would you have for people trying to begin that conversation by phone?
I think just relate to them as you would if you were sitting next to them, in the doctor's office, and start up a conversation. Get to know each other a little bit, ask some questions about people's lives, what do they enjoy doing, and then I think once you've established some kind of rapport, then I think you can get to the point of, is there anything we can help you with? Are you needing anything? Have you had your prescriptions refilled? Those kind of things. But just do what we all know how to do well to begin with, and that is to have a conversation with people. As Regina said, I think it's important to stay connected to people, and because we're all in our houses and not having that contact that we're used to having.
Mm-hmm. So, Regina, as you're looking ahead to, it might be a month, might be 2 months from now, what are you most looking forward to in terms of getting your circle of friends back together in person again?
Getting everybody comfortable with being back with the real world, and getting out more, getting out, doing some physical outdoor things. We've had some combined lunches, 2 or 3 of the sites together around Christmas time, went out to dinner, and one of our facilitators adopted a nursing home. So their people are getting out beyond their normal everyday neighbors, socializing, doing something for someone else, feeling worthy, and that's what I would like to see us be able to do, is just to take it a step further. Take it a step further. That's going to be real important, because all of them are not going to always stay with the group. Some of them are going to branch out. One of the sites, they formed a group within the group. And so in December, when we culminated that first 12 weeks, then they have some other things that they're doing. So just looking forward to newness, some good stuff, being able to look at how this whole pandemic, how it plays out, and what does that mean for seniors in this city and seniors in this country. And by the way, all of our sites that we have here, the sites that we have going are with public housing residents, public housing and mixed income residents. And might I say, Sarah, I love telling everyone this. Marla shared that the program did originate in Finland, and it was brought here. St. Louis University took a step further, and Chip stepped in and said, we'll get this together, along with the help of Marvin Bostic from the Housing Authority and the support of the Housing Authority. But it is the very first group of circle of friends in North America.
Wow. And that's something you guys should be so proud of. And honestly, today it's putting such a smile on my face to hear what you were able to achieve and how well it was going. So, Regina Stewart, I want to thank you so much for joining us today.
You're welcome. You're welcome. Thank you for having me.
And Marla Berg-Wager, thank you as well.
Yes, thank you. And I do want to mention that St. Louis University Memory Clinic, under the direction of Dr. Max Zabatsky, was getting ready to launch an in-person circle of friends, and obviously isn't able to do that. So they are going to be offering it via Zoom conferencing. And so that's going to start up in April. So if there are questions, people are interested in learning more about that, just they can reach out to me.
Well, great, and that's awesome to hear. And so Marla Berg-Wager is a professor at the School of Social Work at St. Louis University and executive director of the Geriatric Education Center there, and she's made an invitation, so feel free to follow up with her. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.